I'm Bimal Patel. I'm the president of Hartford Hospital. First and foremost, our thoughts and prayers for all involved and their family members and their families. On behalf of Hartford Hospital and Hartford Healthcare, I want to thank the first responders on the scene. At the same time, I want to thank our medical professionals here at Hartford Hospital. Our hospital is a great community resource, and it stands ready and prepared during such events 24/7, 365. As a level 1 trauma center, we prepare for such accidents, and our readiness and preparedness are always under the physicians and nurses and their leadership. My physician colleagues, Dr. Robinson and Dr. Gates, will provide further information. Thank you.
Good afternoon. I'd first like to echo what Mr. Patel said, that our hearts are with the patients and their families. Secondly, I would like to recognize all that were involved in the immediate care and the rescue of the patients in this incident. The airport did an awesome job of notifying CMED immediately. The fire department at the airport, as well as the local fire agencies and police and EMS, did a great job of caring for and transporting the patients as soon as possible to our level 1 trauma center. CMED, which is Central Medical Emergency Dispatch, received a call from Bradley notifying that the plane had gone down and that there was a potential for a multiple casualty incident. CMED notified us at Hartford Hospital. We started our MCI, or mass casualty plan, which means basically notifying everyone that we can for resources that we're going to need first in the emergency department and then upstairs. We notified emergency medicine, trauma surgery, the ORs, the blood bank, neurosurgery, orthopedics. We notified our colleagues at both Children's Hospital and the Bone and Joint Institute. We had plenty of ORs on hold, ready to go, each with a team ready to take a patient if we needed to at a moment's notice. We also had social work and the chaplains present in our department as well as pharmacy, local police, our own fire service at Hartford Hospital, as well as a decontamination unit in case we needed that because we weren't sure what the patients had been exposed to. That all happened within a few minutes. We started our mass casualty plan and waited. We have, to this point, received 6 patients, 3 of whom were critically ill, 2 of whom were moderately injured, and 1 was minimally injured. My colleague, Dr. Gates, will provide more detail on our trauma system and the patients.
Thank you, Dr. Robinson. I'd like to echo what he said, and indeed we were quite prepared when we heard about the plane crash. And this involved many people in the emergency department, as you can imagine, with physicians and nurses. In the trauma center, we had no less than 7 trauma surgeons present, and the ICUs were ready. We actually had secured 11 operating rooms between Hartford Hospital and the Bone and Joint and Children's Hospital as well, in the event that they would be needed. It turns out we didn't need those ORs, but they were certainly ready, and as we learned more about the event itself, we were able to then release those operating rooms back into general circulation because, as you can imagine, it's a busy operative day today. And at this point, we are continuing to care for those patients, and we have orthopedics and neurosurgery and anybody available. And this is exactly what we do as a multiple casualty event. And this is an event that we really do have the resources and a really deep bench to take care of this number of patients.
If you have questions, you can.
Please.
Were there any children taken to the hospital?
There were no children taken to Hartford Hospital. We're not aware of any others that were transported from the scene at this time.
Can you give us an idea? You named all these different departments. Like, how many people were involved? How many Hartford Hospital employees were involved in this all hands-on-deck situation?
I would venture a guess well over 100.
Probably 50 to 60 alone just in the emergency department, and then all the other units Dr. Gates mentioned, the ICU, the ORs, the blood bank, other ORs at our 2 neighboring hospitals.
Can you talk about the type of injuries that critical patients had?
We're not going to mention those specific injuries, but I can tell you that any plane crashes or falls from a great height are certainly what we call deceleration injuries. And the trouble is that you could see almost any injury from that type of event. And as you can see, as we were watching the news when this was unfolding, there was a fire on board, so we're always concerned about burns. But orthopedic injuries, neurosurgical injuries, and internal injuries, we always worry about those.
Can you confirm any casualties at this time?
For the sake of the families, I think we'll just leave that alone at this point.
So would it be accurate to say at this time all 6 patients that were brought to Hartford Hospital are still alive?
We haven't had a chance to speak with the families yet, so we really shouldn't be giving out any information regarding their injuries. Sorry about that.
Can you explain what a multiple injury situation is for people at home? You explain what it means for your employees, but what does it mean to the general public?
Well, I can tell you, I think what you maybe you're referring to are multiple casualty incidents. So we hear the term MCI, and that can be multiple casualties, which is indeed is what we have. And we see this periodically around Hartford. In those events, we have enough resources at a hospital like this, and including our other neighboring hospitals, to be able to care for everybody exactly as though they came in individually. In a situation where you have what we call mass casualty, which is also called an MCI, there are so many patients involved that it would outstrip the resources at any one hospital really in the United States. So that's why it's a great idea to have multiple trauma centers within a system, multiple trauma centers within a state, and to be a ready to go level 1 trauma center at all times, 24 hours a day, because we're in a position to care for patients that come in at any time.
What is a level 1 trauma center? What are the different levels, I guess?
So there are really 4 different levels. The American College of Surgeons is responsible for that verification and certification. And the level 1 is the highest level. And it implies that we can take care of really any injuries that occur in any number of patients that are involved.
Are you all expecting any additional patients?
I don't believe so at this stage.
What are the ages of the patients that were brought in?
Can't say that.
Can't say it. Right.
Can you say whether or not any of these patients might be transferred to Bridgeport or the burn unit?
Yes, I think I can. So we will send 2 patients to the burn unit. But again, as a level 1 trauma center, we're in a good position to be able to get those patients stabilized, to rule out other injuries, to deal with some of those other injuries before deciding they're stable enough to be transferred for the better care of their burns.
And to confirm to the Bridgeport Hospital, to the burn unit?
That is correct.
For you as doctors, when you hear there's been a plane crash, what goes through your mind immediately?
Well, I can tell you, I mean, I think, we had no idea how many patients to expect, but we know it can't be good. And we think that we have the resources to really care for anything that comes in that door. And I can tell you there's a sense of pride for that, to be able to say, yes, I'm part of that, and we can really step up to the plate and take care of patients like they should be taken care of.
And from my perspective, that's why I work at a place like Hartford Hospital, the biggest hospital around. We train for this. This is why we're here, because this is the work that we like to do. And our teams, all the teams are ready for this because we train for these types of multiple casualty incidents.
Can you talk a little about the training? I know we're here at CESI. You do drills like this all the time so that you are ready at a moment's notice.
Well, we do drills, as you're referring to, at CESI for individual patients. We also do a disaster day drill at CESI, and then we also drill in the emergency department with all the teams involved, with mock responses, real responses, but mock situations from all the departments involved, so that on a day like today, everyone knows what to do. We know where all the equipment is that we need, all the bags of our equipment. It's just, we're ready for it, and that's why we're here, and that's why we're a level 1 trauma center.
Have any of the family members arrived already?
I don't have any information on that.
So earlier it was being described as a sea of blue and white. What's the situation now inside the hospital?
Well, I think that we've had a chance to really look over the patients, take care of them, get them stabilized, and then we're able to release some of those resources that we thought we would need that we ultimately did not need at the time. So I think things are back to functioning as usual, and we're able to care for patients that come in for other reasons now.
When you mentioned moderate injuries, what does that equate to in like critical? Would that be stable or?
Yes, I think it would imply that the patient is stable, but, they could be significant.
critical.
Yes, they could be significant injuries, and they need to be taken care of, but perhaps they're not life-threatening injuries.
Now, in this situation, you used Hartford Hospital for all of the patients, but you are the system director of trauma. Do you want to talk a little bit about what that means and bringing in the different resources of the different hospitals if you needed to?
Yes. Well, if we needed to, we have the resource of Bacchus Hospital in Norwich and St. Vincent's in Bridgeport. And Bacchus is a level 3 trauma center, Bridgeport is a level 2. And we would be able to care for additional patients if we exceeded our capacity in a mass casualty incident here at Hartford Hospital. We'd be able to transfer patients to those other hospitals. They're really part of our system. We know the people in the emergency department, in the general surgery services, in the orthopedic surgery services, anesthesia, and other groups. So our communication is excellent among those groups. And we're working very hard to really coordinate that effort statewide. And I think when you look at what we could do here with Hartford, Bone and Joint Institute, and Children's Hospital, and then add into that a Bacchus, which is about a 200-plus bed hospital, and St. Vincent's, which is even larger than that down in Bridgeport, there's a lot of capacity in the system.
For the hospital, what number constitutes a mass casualty?
Well, I think that what we've learned over the years is that a hospital like this, and really any large inner city hospital, can manage 6 really, really badly injured patients. And probably above and beyond that, even a hospital as well equipped as this might be overwhelmed. So you could take 6 badly injured patients and 20 less severely injured patients. But if we had 10 badly injured patients and said they all needed an operation, even we would be stretching our limit a little bit. But that's in a situation where you can evaluate them and decide who goes first to the OR and stagger them into the operating room if we needed to. It's not a great situation to be in. Having been there, I can tell you it's an uncomfortable situation at times. That was not